Sweden's controversial pandemic policies have allegedly paid off, according to a new study. As the U.S. and much of the world hunkered down at home due to the coronavirus pandemic, the country, Sweden, had a very different response to COVID that did not include strict lockdowns, mask mandates, and school closures.
Senior fellow at the Cato Institute, Johan Norberg, investigated how the Nordic nation managed, posting on Twitter yesterday, quote, "How did Sweden fare during the pandemic? Back then, the world was shocked by our openness. New York Times called us a cautionary tale. Trump said Sweden is suffering very greatly, but we never heard how it all turned out. Now I've looked, Sweden did better than others." Here to detail what he found out about Sweden's fate post the pandemic pandemonium is Johan himself. Welcome, Johan.
Thank you.
All right, so first, walk us through the decision-making as you understand it in Sweden. Why was there a choice to take such a different approach than much of the rest of the world?
Well, what Swedish authorities said at the time, and the Social Democratic government said at the time, was that Sweden didn't take a strange, unprecedented decision on openness, but other countries took a strange, unprecedented decision to lock down their countries. That was not something that was in the plans for a pandemic. So it seems like the Chinese decision to lock down the economy, put people under house arrest, sort of got people and countries to panic and thinking that this might be the only way to stop the virus, whereas Sweden didn't throw out the manual, but basically stuck to the plan, tried to protect the vulnerable, but keep society, schools, and businesses open.
So there was a different policy in terms of requirements. Is your argument that there was still much, voluntary, neighborly, good behavior that the people of Sweden adopted without having been forced to do it by the government? That's my first question. Then my second question, walk us through the numbers a little bit, because I remember people having concerns about Sweden having a higher infection rate or a death rate early on, maybe during the first year. But is the argument that equalized over time, and then it's harder to say after the whole duration of the pandemic that the experience in Sweden was really any worse than anywhere else?
Yes, Sweden did have restrictions and regulations, but not at all to the same extent that other countries did. It was mostly reliant on recommendations. Try to stay at home, work from a distance if you can do it, avoid public transportation if possible. But there wasn't any kind of government enforcement of those recommendations. But when you look at things like mobility data from our cell phone providers and other things, it seems like Swedes adapted voluntarily almost to the same extent as our European neighbors did. Originally, in the first few months, and that's when New York Times and Donald Trump explained that Sweden was suffering heavily, becoming a pariah state, basically. Yes, Sweden got more of the infections, more deaths than at least many neighboring countries. Then it was what Swedish authorities said that this will even out in the long run, because no one can completely avoid social interaction for years. And that's why it's important to look at total mortality, excess deaths above a previous trend. And then what we see remarkably is that Sweden's excess death rate is one of the lowest in Europe, according to some calculations, the lowest in Europe and less than half of America's.
Yeah, help me understand. You mentioned earlier that there were still protections for vulnerable people. I'd like to know more about what those were. Of course, Sweden does also have universal healthcare system. You're not experiencing the situation we have here where people go medically bankrupt with some regularity. Medical bankruptcy is not a term that exists in most of Europe and the developed world. But help us understand how it was the case that people still managed to feel like there were protections absent mandates, and what was the compliance rate, as you understand it, for people using those kinds of interventions, whether it be masking or working from home and the like.
Yeah. Well, when it comes to protecting vulnerable groups, the priority was to protect the elderly and recommending them to avoid meeting their young relatives. And obviously, some people say that that's easy for introverted Swedes who rarely meet their old relatives anyway. But I think that it definitely led to more social distancing like that, protecting elderly care, nursing homes for the elderly, while even though that's an area where it came too late, I think it ended up infections in the nursing homes at an early period. But many attempts and even restrictions were done in that area. Also, healthcare generally, as you pointed out, there was an attempt to rapidly scale up intensive care units and building an entirely new field hospital here in Stockholm, for example, to protect those who got the infection anyway. But above all, trying to recommend everyone to avoid social interactions if they could, and according to mobility data, that happened.
What about schools? Obviously, in the U.S., what to do about schools was one of the more divisive, politicized arguments. Schools here, in certain parts of the country, stayed shut a lot. It depends if it's public school or private school, what state you're in, what's the political makeup, and the closures and masks and even vaccine requirements in some places. What did Sweden do on that front?
In Sweden, it was seen as a priority, and this was a consensus opinion, I would say, across the political spectrum, to keep schools open, because we didn't know what was going to happen with the virus, the disease, how long this was going to end. We only knew that if we shut down schools, we will ruin months, possibly a year of schooling, and that will be incredibly detrimental to kids for the long term. And not just economically, but health-wise, we know that schooling is an important predictor of future health, life expectancy, and things like that. So elementary schools were kept open all throughout. And this is an interesting result when we now look at what happened all around the world. School children lost months or even a year of schooling, and it's been a disaster for education. I think the U.S. Department of Education concludes that half of American students began 2023 a full year behind grade level in at least one subject. But in sharp contrast, Swedish elementary school has suffered no learning losses during the pandemic. And I think that's pretty unique. And that's something that we're very happy about now.
How generalizable do you think the Swedish trends are when you look at some of the other factors that can influence excess deaths and comorbidities and the like? 1 out of every 3 Americans is obese, 2/3 are overweight. Only 1 out of every 10 Swedes is obese. The comorbidities include things like asthma and diabetes, which are overrepresented, particularly in urban areas and poor communities due to the exposure to air pollutants and the like. And obviously, there is more of that in the United States than there is in Sweden. Is there a risk in reading too far into what is interpretable data here with respect to excess deaths as other people in different parts of the world are planning for future pandemics?
Yeah, no, that's a very good question. And I wouldn't want to explain to every other country how to deal with a pandemic, but I think it's important to look at the Swedish model and how it worked out, and then try to adapt this to local circumstances. It's definitely a fact that there are fewer conditions like obesity in Sweden than in the United States, but not more than in the Netherlands or in Germany, in Belgium, I don't think. So, and I think this will keep researchers busy for years trying to adjust all those numbers to other health conditions in a population. But what I think is important to point out that is also that perhaps a way to live with social distancing for a longer time is not to try to politicize it too much, because in the end, you just start breaking the rules if you think that this is just some sort of administrative elite trying to tell you how to lead your lives. And in Sweden, in many ways, social distancing could keep going for a longer time, precisely because it was never politicized. People just try to protect themselves and their loved ones. And that's an important lesson to everyone.
Johan Norberg, thank you so much for joining us.
Thanks for having me.